It's our patient, 60, how old you said, I'm sorry?
66.
66-year-old male. He had 4 trigger finger, left third finger going on for maybe about 2 months. Tender right at the A1 pulley of the third digit, just proximal to the MCP joint. I'm going to go ahead and just inject that flexor sheath with cortisone. So this is a case where you're going to do sterilely because you don't want to contaminate your probe. Focus on. Here we're going to go over this third finger, trigger finger injection. Here we can see we're looking at the palmaris longus and how his tendons spread out among the digits. Here's the flexor carpi radialis. Here's the flexor digitorum superficialis and profundus tendon sheath surrounding those tendons. And this tendon sheath extends distally, specifically over the profundus and superficialis tendons over the 5th digit. Here's the flexor pollicis longus tendon sheath. And here's the flexor carpi ulnaris tendon without its sheath. Now we're zooming in, and we're going to focus on this area of injection, making the palmaris longus a little bit translucent here. And there's the A1 pulley, there's the C1 pulley, here's the A2 pulley, and then on the 4th digit we're going to focus here on the C2 pulley. Now you can see that A1 pulley getting a little bit thicker along with the tendon sheath. Now we're making the flexor tendon sheaths translucent. Here's our probe and needle position. This is a short axis approach to the needle where the probe is in an axial plane relative to the digits, and we're essentially just going right into that tendon sheath, just proximal to the A1 pulley. Here we are just zooming in to get a better sense of the needle position relative to the A1 pulley. Good, looking at the third MCP joint, you can see the flexor tendon right above that. See how it divides into 2 with the profundus and the superficialis. And here are the tendons where you can see the flexor digitorum profundus just underneath the flexor digitorum superficialis tendons. And you could make out a fine line between those 2 tendons here. There's his PIP joint. And again, the flexor digitorum superficialis inserts on the middle phalanx, just beyond the or distal to the PIP joint. The left side of the screen is towards his 5th finger, and right side is towards his thumb. And here we are looking at the flexor tendon in axial view, where you could make out a very subtle division between the profundus and superficialis tendons. We're looking at the 3rd flexor tendon. Right over there is where you most tend to hook. So here we are making our injection over the A1 pulley. Okay. And here you can see the tip of the needle, and it's essentially right above the tendon and within the sheath. Just stay there because I'm going to pay a thing quickly again. Here we go. However, also some of the injecting went superficial to the sheath, which you can see here as well. But if you look carefully, you can see some of the injectate within the tendon sheath as well. So this was a case where the tendon sheath was injected as well as some cortisone got superficial to it. But fortunately, he did well from this procedure. We're about a week follow-up from a trigger finger injection, the left third finger. And let's see you bend it, straighten out. Good. How's it feel?
Yeah, it feels much better than what it was, man.
You don't have that pain?
Nah, I don't have the pain, just, the crack.
A little bit, but not too bad.